We're here with Dr. James Hubbard, a survival medicine expert and author. Now, not only does he have a few books out, and we'll get to that in a little bit, but specifically, we have him here to discuss the Ebola situation. Certainly, we have heard that it was no big deal, and then we've seen in recent weeks that some of the crew that was first responding to the initial Ebola patient have come down with Ebola. So, do we need to have ourselves on alert?
Should we have a plan in place? He is the survival doctor, Dr. Hubbard.
I think you ought to be aware of it. You ought to know that it is a horrible disease, and then you should do what you want to do, keep up with the news, and then just live your life.
With that said, Dr. Hubbard, not to make things too simplistic or to go overboard in a scare tactic, but let's recap the ways that one could attract Ebola and then the things we can do to prevent that from happening.
First off, we've had one person come from the other country that has had Ebola. We've had other scares. People have been isolated. That one person that came there, I just think it was expected, and there's going to be expected that several others are going to have Ebola once they get here, with noting that the air travel and noting people can get here in various ways, and that there's an incubation period before you start getting sick or getting symptoms or getting contagious or being able to really tell if you have it or not. Well, there are going to be some other people coming.
And how do people contract Ebola, I think is what Kimberly was also asking. Is it airborne, bloodborne?
People say it over and over again, and then other people, you get it from direct contact with bodily fluids. There's been no evidence of any sort that it is airborne like the flu or something like that. And you can do with it what you want, and you can go in your house and stay there, or you can say that's not true, whatever. But I think people have to be practical, and again, like I said, we have to live our lives, because there's always some infection. This one's a horrible one.
What are some of the symptoms, Dr. Hubbard, that you're aware of that people will start to come down with, so that we can all be aware if we see something like that, maybe to take notice? And
somebody who has fever, vomiting, and abdominal pain, diarrhea, and who's going to have that? A fourth of the population of the United States here, with the flus and the viruses and everything going around. Another thing, though, that you need to know is, have they been exposed to somebody direct that has had Ebola within the last 21 days?
And Dr. Hubbard, I want to talk about treatment for a moment. A lot of people say that it's more your own immune system has to basically fight it off in order to survive. And then other people say that, well, there is treatment that's being worked on and developed. What do you know about it, and what are your thoughts on treatment for Ebola?
I think you got to look at viruses in general. In general, there's no good treatment. There's nothing like an antibiotic that kills a bacteria. There's just no good treatment for them. Our bodies have to have time to live through this, our antibodies and everything to fight it off.
well, thank you, Dr. James Hubbard, for joining us about the Ebola scare, and certainly we'll be reaching out to you as more information becomes available and we see how this thing progresses.
Thank you, and you can check out my website at thesurvivaldoctor.com.
We're here right now with Sal Payne. He's actually calling us from the car, but he is the foreman and chief safety officer for BioRecovery Corporation. And his company has been contracted to deal with this Ebola waste, including the quarantine planes at JFK. So with that said, thank you for being here, Sal.
Thanks for having me on again today.
You know, what a difficult job it is that you have doing this cleanup, because I think even on the write-up, it had said the government doesn't even want any responsibility having to do with this scary Ebola cleanup.
They don't want the liability involved.
Yeah.
So our own government won't even take over
Right.
the cleanup of this waste. So
kudos to you and your company for taking it upon yourself to keep us safe. Why don't you start to explain how it is that you do your job?
Well, for the past 20 years, we've been doing situations like this. We've been contracted by the government because, like you said, the government does not want to touch this, quote unquote, with a 10-foot pole. The liability is absolutely through the roof. We continue to do it. We've done it with them for 20 plus years, from the anthrax in New York City to different types of pathogens and bacteria that have actually outbroken throughout the years. Some you may have heard of, some you may not have heard of. It's a part of our day-to-day life. It's, you guys go into your job every day. We do the same. The only difference is we wear a suit that's a quarter of an inch thick.
So we were looking at a picture, and we actually saw somebody that was part of a cleanup crew, not necessarily your corporation, so we want to preface this by saying that, but they were speaking with a reporter, and the reporter themselves was just in plain clothes. Wouldn't that be cause for concern?
We've critiqued the cleanup company over in Texas many times with government officials, state officials, media. I can't condone to what they've done. I mean, watching what their standard operating procedures were unethical and off protocol, to say it lightly. To see them not quarantined after a cleanup, they were in direct contact with one of the most dangerous viruses known to man. And 20 minutes after they were done with their job, they were on TV on camera. Our men and women, after we do a cleanup, will be quarantined for a specific amount of time. Blood samples would be taken and temperatures would be read multiple times. They would be under full medical surveillance until they're cleared to go home to their friends and families.
Al, I understand that your company, BioRecovery, are going to be responsible for quarantining and cleaning up some of our military as they return from some of these countries over in Africa, correct?
Absolutely. We're working directly with the U.S. government and the Army Corps of Engineers and the Army to set up decontamination processes and make sure that all of our men and women that are coming home get, clean, disinfected, and properly medically surveillance so that they don't return home and contract the disease the virus to other people.
Sal, can you just kind of walk us through real quick the actual process that you folks use at BioRecovery? You talked about the suits that you have, these Class A suits. What do you do with the waste when it's done? Because something that is one of the most highly contagious things known to man.
Where does it go?
Where does it go?
It's not going in my backyard, I'll tell you that much. Right now we have an approved medical waste stream, it's called. We have an approved medical waste stream going from wherever the site is, which is called a cradle to grave method. It goes from wherever the site is to the grave, which is wherever it's completely incinerated at. We have an approved method with the DEC, the EPA, and the Department of Transportation to transport it from wherever it is going, wherever it's coming from, to a facility of an undisclosed location. Once it's incinerated at several thousand degrees, it has no remnants whatsoever. It is completely unrecognizable. There will be no DNA characteristics left inside of it. It will be 100% safe. And at that point, if they'd like to bring it in my backyard, they can bury it in there for no cost.
Kudos to you and to BioRecovery Corporation for taking it upon yourselves to help with the cleanup. Again, we've been with Sal Payne, Foreman and Chief Safety Officer of BioRecovery Corporation.